The following video shows the proper donning and doffing of the recommended PPE for treating a person under investigation, PUI, or a confirmed COVID-19 patient. First, gather the necessary supplies. You will need an appropriately sized N95 or P100 mask, an impervious gown, goggles or full-face shield, 2 pairs of gloves, alcohol-based hand sanitizer, and if available, shoe coverings. The driver will need an additional gown, set of gloves, and goggles or full-face shield. Place these in the cab of the transport unit. First, clean your hands using an alcohol-based hand sanitizer. Once your hands are dry, you will apply your appropriately sized N95 or P100 mask. Do this by grabbing the outside of the mask using your thumb and index finger to shape the flexible nose pieces. Place the top strap around your head above your ears and the lower strap around your neck. Tighten the straps as needed to form a tight seal. To check for a proper seal, move your hands around the edge of the mask while exhaling and inhaling to feel for leaks. Remember, the N95 or P100 mask is for the provider only. When able, and after your PPE is properly donned, place a surgical mask or, if needed, an oxygen mask on the patient. It may be appropriate to place a surgical mask over a nasal cannula. Don your gown. Be sure to adjust the front of the gown high on the neckline. Loosely tie the neck and waist strings. This will allow for easier removal. When putting on your second set of gloves, make sure to have them extend over the wrists of the gown. If needed, use a larger size glove. Partners will check each other to make sure that all infection control PPE has been properly placed and fitted. After the transition of patient care at the hospital, you want to properly remove your isolation PPE. Before removing your PPE, look over your gown and gloves. Then look over your partner's gown and gloves to make sure there are no tears. Once you see that your PPE is intact, apply an alcohol-based hand sanitizer. Use medical shears to cut the strings on each other's gown and decontaminate the medical shears. Carefully remove your gown by grabbing it at the front and begin to roll it up, out, and away from your body. Continue to pull down the sleeves. Finally, you want to remove the gown with the outer layer of gloves and place it in a biohazard bag. Now re-sanitize your gloved hands. When completely dry, you want to remove your goggles or full-face shield by grabbing the outer edges on both sides, pulling forward and away from your body. After removing the goggles, properly decon them and store them for reuse. Re-sanitize again. Now take off your mask, the same as your eye shield. Grab the straps around your head and neck by pulling it up and forward using an aseptic technique. Remove your initial pair of gloves. Roll your first glove off, grabbing it with your still gloved hand. Now place your bare finger in the cuff of the glove and take the glove off, covering the other glove. Place in a biohazard bag. Once isolation PPE is doffed, you want to use an alcohol-based hand sanitizer. Finally, wash your hands and exposed skin around your face and neck with soap and warm water. Remember, you will need to be in full PPE to decontaminate any reusable medical equipment, stretchers, and ambulances.